Like Kira said, my name's Jen Baker. I'm actually the Director of Clinical Education for Suniva Medical. I have a team of 40 clinical educators in North America, in the United States, and in Canada. And we are comprised of nurse practitioners and MDs, and we have some RNs as well. And we go into accounts and we train accounts, whether you're new or it can be an advanced training as well, on our portfolio of products. Mostly where I'm going to be talking about 2 of our products because they are our biostimulatory and regenerative products. Again, what Suniva is as a company, and really our platform, is that we use regenerative biostimulating agents to create fill, structure, and lift in your patients. When looking at what patients want, we utilize lots of different surveys, and one particular survey that we use a lot is called a Harris poll. And you can see that it has changed significantly in the world of aesthetics, and all of you probably know this and you've seen this depending upon how long you've been in practice and how long you've been seeing patients, that, Andrea, is that your name? Audrey, sorry, made some really beautiful points and showed us some great statistics. And, really to her point too, our younger generation, which I learned that I'm barely a millennial, I'm hanging on until December and then it's over. But this generation that's younger that we treated, I've been doing this for almost 20 years. I owned a medical spa and outpatient surgery center in Los Angeles for 15 years. And now, of course, I'm on actually the East Coast, and I do still see patients, but I sold my practice in LA and focus on education. I absolutely love it. But nonetheless, I've been seeing too is that these younger group of patients coming in, they actually want longer lasting products, biostimulatory products, regenerative type products, and devices, treatments. I feel like even as early as 5 years ago, that group of patients really wanted more augmentation, and they were more interested in the quick fixes and the quick fillers, and they've really started to learn that over time it's better to use something that's longer lasting, potentially even autologous and biostimulatory. Of course, we see this. I think the reason why that dropped off slightly, I have to be careful with my time. I tend to talk a lot. The reason why I think that's dropped off at age 60 years old, I think a lot of you can probably agree with me. You'll have these patients who are a little bit older and they say, I'm not going to create any collagen anymore. That's not true. It's a wound healing cascade of events that we are achieving. And so if you heal from a wound, you're going to gain benefit from any type of fibroblast activity, any type of biostimulatory product, and regeneration. What is this? I think it's more of kind of the same as far as our group of patient base and their aesthetic needs. And of course, we talked about, enhancement in the younger group, prevention, and then anti-aging. But I do think now aesthetics has changed, like I said, and we can actually offer them all of these things in every range of ages. Our portfolio of products, like I said, we really focus on regeneration, rejuvenation, and biostimulatory aspects. So we have structure, volume, lift, and regeneration. Structure and volume is our 5-year long dermal filler. Oh my gosh, I need to hurry up. Our 5-year long dermal filler, it is comprised of a proprietary bovine collagen and polymethyl methacrylate. Those 2 components, structure and volume, you can utilize Bellafill to restructure face, restructure jawline, etc. And then, of course, you can also volumize. The one I really want to talk about more is, of course, Silhouette Instalift, because that is our partner with Sinclair. And then we have a few other rejuvenation products, Plasma IQ, which is a handheld little plasma device utilized for ablative laser treatment to resurface the skin. Celuglow MD, I think we have a giveaway. I saw it up on the screen earlier out at the booth. We have some of our sales reps out there at the booth, and I think we have a giveaway on those, which is kind of a stamper device, like if you've ever used Aqua Gold. It's really neat. And then amplifying, which is our PRP tube. There's a proprietary gel separator in there, extracts the most amount of contaminants, leaving you with the highest amount of concentrated growth factors. Suniva does have a proven success of 4 steps, and really without going through all of this, there's marketing and there's sales in step 3 and 4. And when we're looking at steps 1 and 2, what we really focus on is clinical education. I know, being in clinical education for 13 years and then now in the director's role, and that's really my life, is we all know this, that if we feel confident and competent in a product that we're using, a device that we're using, then we are going to provide the best, highest quality, most efficacious treatment to our patients. So when we learn appropriately, we're gonna leave that setting feeling confident and feeling competent. I wanna use this. What we're excited about, we're going to share that with our patients. Bellafill, again, I'm going to go through this pretty quickly because I mostly want to talk about Instalift. But Bellafill, again, is a biostimulatory filler that lasts 5 years. We have clinical studies. We actually have the longest and largest clinical study ever conducted of any dermal filler ever on the market. Over 5,000 patients have been tested for over 5 years. And I love this little graph. It's a very, very simple little graph, but to briefly explain it to you, there actually are flyers out at the booth out there, and I highly recommend you just grab one because, is there a pointer on here? Oh, cool. The reason why I love this, actually, we came out with this about 13 years ago, and I printed this, laminated it, and had it in my office. I still use it today when I talk to my patients because I explain to them this little area right here, and I circle it on my laminated little paper. And right here, I write Radius and Sculptra. I don't talk bad about any products. I think they all have their place. I love Radius and Sculptra. They have their places. But if you look at the x-axis and the y-axis, the x-axis is these colors show you a volumization, and then the y-axis is your time in months. So with Bellafill, because it is a homogeneous composition of bovine collagen, which is proprietary, the telepeptide has been stripped, so the anginosity is nearly non-existent. So the rate of allergic response is extremely low. Nonetheless, you get immediate volumization from that, and then 20% of the syringe is composed of the polymethyl methacrylate. That starts to create the wound healing cascade of events, right? So your body starts to produce collagen 3, as it naturally would, and then naturally we're going to have a significant decline in collagen 3 because that's starting to stimulate really that taking off of collagen 1. Again, this is just standard wound healing process, but the beauty of it is, if I circle this right here, calcium hydroxylapatite and polyol lactic acid, Radius and Sculptra, both of those particulates will be gone in 30 to 90 days. Right here. The only product that can continue to give you that collagen 1 that's long lasting, which we have all of our clinical studies showing that it lasts at least 5 years, is Bellafill. Because with the other 2 biostimulatory products, they're going to stop producing that collagen 1 here, and then they're just going to kind of plateau, and then it's just going to slowly go down over time, which is why you have to keep injecting, keep injecting. So that's the big difference. So when I'm trying to explain it to a patient, if I can give them this visual, it's a huge change of mindset for them to see, oh, I get it. And then to one of your points is that I would bring their file, into their room. This was back in the day when we were still all using paper. And I would bring it in and I would show them, look, over the last year, 2, 3, 5 years, you have spent this outrageous amount of money, right? Because you're always in here doing these temporary fillers, and then we're trying to gain additional volume here, and you don't have enough money to do here, which we really want to do. But if we can use something that's going to last 5 years, we can actually treat all the areas you want to treat, and then we're setting the baseline back. So it's a completely different product, and I always like to say that Bellafill was introduced way before its time. This is a very revolutionary product that is the Bentley of products in your practice place. Really quick, I'm just going to show you. I do geek out on the science, and this is just a quick histology slide. So we did do an internal study on mechanism of action. And we utilized the tissue from 18 patients who had abdominoplasty. If you know anything about this, they get these little dog ears right here. We injected Belafil into the dog ears, and then we extracted that tissue, and we utilized that for histology studies to show that in 1 week, all these little white circles you see, that's all PMMA. Those are all the microscopic little microspheres of PMMA in tissue. And then you can utilize enzymes to highlight collagen 3 and collagen 1. They're two different types of enzymes. And you can see at week 1, this is just, normal tissue, not a lot of collagen 3, and then it's very robust at 2 months. And then it really drops off at 6 months. That's what we want to see, right? Going back to the first little graph I showed you, because this is the natural cascade of process of wound healing. And then this is collagen 1. There's some collagen 1 in there, and then it starts to really produce, all the gray brown areas are what I'm looking at the 2-month mark, and then you can see how nice and robust that is at 6 months. Which this was really fun for us because we have actual histology to show what's happening. Just a quick before and after of some Belafil. She was treated, obviously on the right side. This is immediately after. The cool thing is, Belafil is nearly a neutral pH, and so you get very minimal, if any, swelling. So patients can have 5, even 10 syringes in their face. Sounds like a lot, but it works a little different. And they can go out that night. They look awesome. That's just a gentleman. He had 5 syringes in his face. And then, like I said, we have the largest and longest clinical study of any dermal filler on the market. And then our rates of AEs are right on par with all of the non-Vicross hyaluronic acids. And I make that very clear because we know that the Vicross technology does have a much higher incident of granulomas and or nodules. So Belafil, over 1 million syringes distributed since 2007. Our AE rate is 0.11. We definitely, that's right on par, like I said, with non-Vicross HAs throughout the portfolio of products, all companies. We attribute this to excellent clinical education. Knowing how to use your products, knowing how to use them right, knowing the right patient, you're gonna have great outcomes. Belafil pearls, I'm not even gonna talk about this. Don't bolus it, that's it. Silhouette and Slift, okay. This is our newest baby. We've had this for about 3 years. It's incredible. When we're looking at treating our patients, we came up with these, 4 R's of facial rejuvenation, which I really love this. It's very simple, but it really helps. I also like to show patients this. Aging has many etiologies based off of the different tissues we're working in, how the cells are performing in those various different tissues. And so you can resurface. We can, obviously with all of our great lasers, chemicals, et cetera, we can relax with all the neurotoxins. We can refill, of course, with all of our great fillers. But then we need to actually take all that tissue that we've treated and we need to be able to reposition it, because sometimes, we all know this, filler just starts to look odd. It's too heavy, it's too much, it's just not doing what we want it to do. So if we can take all that nice new filled tissue and reposition it, that's the goal. Silhouette Instalift is composed of, it's a monofilament, which is poly-L-lactic acid and a co-glycolic acid. Essentially, it's a monocryl suture, which means that it remains in tissue for 12 to 18 months. But because it is biostimulatory, you're producing all that nice collagen 1 around it. Not only do you get a revascularization in the tissue, which means more blood, which means more oxygen, you have this beautiful glow to your face. Kind of like when people say, the Sculptra glow, we say Belafil glow, and we say Instalift glow. I'm not going to go through that because I'm almost out of time. But the reason why this thread is so effective is because of this three-dimensional cone technology. Okay, that's a huge microscopic view of what the cone looks like on the thread. They're itty bitty. We have an example out there at the booth, so I highly recommend you look at it yourself because they're so tiny and cute. The difference is if anybody uses PDO threads or any other threads on the market, most of them are laser cut, and you're trying to utilize this little junction here that's going to potentially grab onto tissue. A lot of times these barbs, you can imagine if it's laser cut on a very, very fine thread, like a strand of hair, this barb just kind of bends back. You don't get a whole lot of lift from it, darn it. But these cones are 3-dimensional. They grab onto the subcutaneous tissue, and it's incredible the lift that you can get with these. Super, super fun. Collagen production, we have different sizes. I can show you that. And then here's just a couple before and after. So this is immediately after. You can see her nasolabial folds, her marionettes. You can see her jowl and even this tissue here and how much better that looks. That's immediate. So it only continues to get better and better. I have tons of pictures on my phone. If you're interested, I'm happy to show you some of my patients. And this is immediately after as well. Just look at her jowls here and her neck. I mean, this is a game changer for my patients. I do these every week. Okay. Thanks.